Hi, welcome to Mondays with Melissa. I want to talk a little bit today about Medicare coverage and Medicaid coverage, especially as it pertains to rehabilitation and nursing homes. So when someone's been in the hospital for at least 3 days and then they go to a rehabilitation center in a nursing home, so typically it's a floor in a nursing home, they will have coverage under the Medicare program for up to 100 days. Medicare covers the first 20 days in full, and then from days 21 to 100, there's a copay. That copay may or may not be covered by the individual supplemental insurance, and it's important to know whether or not it is. Otherwise, that copay will have to be paid for privately. Now, what's really important to know is that anywhere between days 21 and 100, Medicare can cut the individual off if they feel that they're not progressing with their rehabilitation. And then the person becomes private pay for the full cost of care. Now, they may be coming home or they may be staying long-term in a nursing home, and that's another conversation for whether or not we want to get them on community Medicaid to pay for home care or nursing home Medicaid to pay for the long-term care. But the Medicare coverage is limited. Medicare is not going to cover the full cost of nursing home care ongoing. Another thing to keep in mind is that there are Medicare Advantage plans, which are a Medicare and health insurance kind of rolled up into one. Sometimes those plans have a little bit of a different Medicare coverage where they'll pay in full for, say, 30 days or 40 days, and then that's it. So it's really important to get information about your Medicare supplement or Advantage plan to know exactly what you're looking at down the road if you should ever need that type of care. So I hope that's a helpful tip and something that you can look into now, because looking into it during a crisis situation can make it much more complicated. If you have any questions, please post them in the chat. Otherwise, we'll see you next week.